Good afternoon, everyone, and welcome to today's webinar. My name is Kelly McCarthy, Communications and Social Media Manager with the Canadian Cancer Survivor Network, and I will be moderating this session. Today's webinar, Cancer-Related Fatigue, Energizing and Empowering Yourself on the Cancer Journey, focuses on this common cancer symptom and how to overcome it. We are pleased to welcome today's presenter, Dr. Rob Rutledge, Radiation Oncologist in Halifax, Nova Scotia, and Associate Professor in the Faculty of Medicine at Dalhousie University. Dr. Rutledge is the CEO and Chair of the Healing and Cancer Foundation, a registered charity that freely offers educational videos, documentaries, and live and webcasted seminars. In 1999, Dr. Rutledge co-created the Skills for Healing Cancer Weekend Retreats. These weekend support groups teach a powerful and integrated approach to the cancer diagnosis and ways to heal at levels of body, mind, and spirit. To date, over 2,000 people have attended one of 50 retreats in 25 cities across Canada and abroad. Following Dr. Rutledge's presentation today, we will have a question and answer session. During the webinar, you can type your questions into the window on your right at any time, and we will read them aloud at the end of the presentation. On behalf of the Canadian Cancer Survivor Network, I would like to thank you for attending today's webinar. For almost 9 years, we have been working to help cancer patients and survivors learn about the health system complexities, connect with others to plan action, and act to promote best care and a healthier survivorship. If you'd like to learn more about CCSN, please visit survivornet.ca. Today's webinar will be recorded and will be available in full tomorrow on the CCSN YouTube and SlideShare accounts. Links to both will be sent to registrants using their registered email. To keep informed about upcoming webinars, sign up at the CCN website, survivornet.ca. And with that, I will pass things along to Rob to begin the presentation. Thanks, Rob.
Thank you, Kelly. It's an incredible pleasure to be here and to present to so many people who are willing to empower themselves and make a huge difference in their lives. And I really feel like it's taken me 25 plus years to actually prepare for this presentation. I've been interested in mind-body medicine for a long time. I've been practicing as an oncologist, and I just feel like the stars have aligned. There's so many factors related to cancer and fatigue that I can really talk to and really make a difference in your life. So I'm excited about being able to present this. I am drawing on a whole body of science now and evidence and procedures and ways that people can actually make a difference in their energy levels and feel better and function better and so on. So I feel like I'm sitting on the shoulders of giants and like really happy to present this to everyone now. So this is the opening slide from a website called mycancerfatigue.ca, and I'm going to refer to that, and I'm really relying on their multi-disciplinary expertise. And you can see that you can empower yourself right from dietary, psychological, exercise, sleep, and spiritual practice. And really, it's that integrative system, getting the best care from the medical system and empowering yourself level with body, mind, and spirit that can make a tremendous difference in your health. And so I just acknowledge that there's a whole team of experts that have gone into preparing this talk. And also I've been tapping into other experts. There's a very, very good website in untire.me. Psychologist has 30 years of experience. I tapped into some of his slides as well. So what are we going to cover? The first thing is the education piece. The fact that you're listening to this, hats off to you. That by itself sends a very powerful signal to yourself, to your mind, your body about getting better, getting stronger, having more energy. And that education piece, it has been shown to actually improve people's energies and fatigue levels just in and of itself. But I also want to offer you the kind of practical experience, practical suggestions, really make a difference, body, mind, and spirit, and also talk about what to do if your energy is low. How do you do something that's practical, pragmatic, and actually make a difference? And it's part of why I was very excited about this talk is there's a kind of whole science around that energy conservation piece and so much expertise out there. And if there's one message that I want you to take away today is get the expert advice. There's a lot of different facets to fatigue, and you can make a tremendous difference in your life if you can tap in and really use the perspectives that help for you. Take home points. Fatigue, as I've just recently learned, is very, very common. I was giving a prostate cancer talk, and one of the presenters talked about 40% of the men who've had prostate cancer diagnosis in the past have an ongoing fatigue syndrome. And that suddenly woke me up to this idea that it's probably an inflammatory process, and you can influence your inflammation and your fatigue level. So it's true for almost everybody. You can improve your energy levels and feel happier and be more productive and do the things that you love to do. So it's a possibility if you do the work. That's another kind of takeaway here. Again, I would say to you, make sure at every facet of this, including the fact that you're fatigued right now, is to getting to talk with your oncologist, getting to talk with your family doctor, talk to them, because there are correctable causes within the medical system beyond what I'm going to talk about today. And lastly, no matter whether we got 52 years to go or 2 years to go, almost all of us are going to come to a place where we have limited energy, and there's a whole set of skills that you can use to actually help yourself in that circumstance. And if you're not going through it, it might be a loved one or a parent and so on. And so another expert is, for instance, an occupational therapist, to help people through the kind of practical issues that are accompany a very low energy level. Now, I recognize that the audience that's listening to this talk will be highly diverse in so many different realms. And so I'd really ask you to think about the advice that's pertinent to your situation. And a lot of this stuff is actually pertinent to everybody. But recognizing people are at different phases, whether they're on treatment, and typically I would be like pushing exercise right from the start. Just after treatment, they might be too tired, debilitated to do much at that point. Long-term follow-up, there's all these different kind of nuances, and each situation is different in terms of what sorts of treatment, the type of cancer, the stage, etc. So I can't talk to each person personally, but I can say, here are the principles, empower yourself. The second part of the equation is people's personality. And because you're listening to this video or watching this webcast right now, almost certainly you're on the kind of proactive side. You're willing to do more for yourself and empower yourself. And that's super important. But there are some personalities that are pushed too hard. They respond by becoming the cancer hero, trying to get up at 5 a.m. and run 10 miles and meditate for 3 hours and go on the internet. And it can be quite tiring. And that personality might need to pull back a little bit in terms of their activity levels. And there's a lot of other people, when they get fatigued, they just say, I'm not going to exercise, I'm not going to do anything. And I'd say to them, you have to, summon that kind of strength, that kind of warrior strength to help yourself improve in that circumstance. So again, that's individualized. And the kind of psychological aspect of it, if you're willing to kind of accept the reality of your circumstance as a starting point, that's a much healthier place to be than fighting against the reality of your circumstance. So that range of acceptance is a critical component, and also maps quite directly to the remarkable cancer survivors. The people that do extremely well are actually able to accept the reality of their circumstance as their starting point before they engage the proactivity. And lastly, as I said, there are multiple causes of fatigue. So how you apply the advice really probably pertains to a fatigue that you're experiencing. Get the medical advice, right? Especially if you're about to start a new exercise program that's going to be harder than simple walking. Please tap into the expertise. Okay, so the education piece, what is it? Why is it important? And you would know this better than I even. So typically we think about fatigue as a subjective feeling, and I have a lot of kind of terms up here. This does not capture it though, in terms of cancer-related fatigue. For someone who's had a cancer diagnosis, this fatigue that I'm talking about is distressing, right? It's upsetting to them, and it's persistent. They can take a sleep, do these things, but it continues to be a problem, doesn't recover in the same way. It's that sense of tiredness, exhaustion related to cancer treatment. And, which is probably the key piece, is it interferes with the kind of usual functioning, the ability to kind of do what you want to do and to enjoy your life in a certain way. So that's the cancer-related fatigue. And I like this from the Untire website. Debilitating, drained, life-altering, overwhelming, depressed, all these this captures the kind of sense of fatigue. I liked another one of the panelists, he described his fatigue. He said, imagine wearing like a 100-pound pack, having the flu, walking for 10 miles, and having a concussion at the same time, right? So he's talking about an exhausting feeling that way transcends any sense of I'm just tired, I just need a nap. So some people really have very severe fatigue. And so it's longer lasting, they can't recover. They're, you know, for most of us, if we do an activity and then take a little rest afterwards, our cup gets filled up again, but this doesn't in that situation. And then it's multifocal. What I call the body-brain connection. When your body's super tired, your brain becomes tired, and so you can't function in terms of brain side. And then this kind of the functional, what happens within your life, whether it's within family responsibilities, work, et cetera, et cetera. And the last thing I just want to show you, so if you can just watch me up top here, is I use the hand model of the brain. So the wrist is the spine, the base of the thumb is the reptilian brain, of fight or flight, and then this is the limbic system, which is, I call the stressed and irritable brain. It's more of a simplification. And lastly, our human brain is very much the frontal cortex. I call that the wise and compassionate brain. And what we're trying to do throughout the day is try to stay in the wise and compassionate brain, have this being the functioning territory within your brain. That's what's going off, making your decisions and allowing you to enjoy life. You know, when people are suffering from fatigue, they often are in the kind of more stressed, irritable brain, and they kind of disengage from their best self. So this is about trying to get back to your best self, and all of the kind of advice that I'm offering is around getting you back to, you know, what you love to do most and how you enjoy your life most. Okay, so what's the impact? Obviously, the person with the diagnosis, and it's so obvious. If you're whacked from an energy perspective, it influences physical, mental, spiritual, activity, role, function, the whole business. Now, it also, you know, when you're so tired, it's hard to get through the treatments and you're less likely to continue on with the treatments. One quick disclaimer, super important. Being tired by itself does not cause cancer to grow. So you don't have to have that unrealistic worry that you're causing, you know, cancer to worsen or allowing cancer to grow because you're tired. But it does make it a lot more difficult to get through the treatment, stay on the treatment. And then obviously, you know, your family members and loved ones are impacted because they care about you, they want you to be happy, they see that distress, they can become more exhausted. And just you know, cancer influences not just that person, but the whole extended family. So I think about the dimensions, psychological, emotional, spiritual, it's pretty obvious. When you don't have the energy, irritable, stressed brain, just difficult to enjoy your life. Then there's the cognitive, you know, having to reread that email because you can't quite focus, or go into a medical appointment, you can't quite understand what's happening. And then just the physical fatigue, right? You know, just inability. You don't often want to even initiate that activity, let alone, you know, complete it because of the fatigue levels with some people. So we grade fatigue along a scale from 0 to 10, and you can see 0 is like no fatigue or tiredness, 10 is the worst possible fatigue you could imagine. And if you have a score of 4 or higher, so think about where you put yourself on the scale right now, then that's a type of fatigue that you would want to actually address for certain, especially if it's 7 or higher. And then last one is just looking at the numbers at the bottom of the slide. Probably 90% of people will suffer from fatigue at some point in their cancer journey. And what's really wild to me is like 40% of people will be an ongoing issue like a decade plus later. And if you think about that, if there are 40 million people who've had a cancer diagnosis or alive now in the world, and 40% have fatigue, that's 16 million people. That's enough people with significant fatigue who could go like hand to hand with each other all the way from Washington, D.C. to Rome, Italy, and back again. That's how long the chain of people would be. So you're not alone is one of the points from that. So know your fatigue score and talk about it. Tell your physician, tell your family, let people know what's happening so they can do something, help you out. Okay, so what causes it? It's a busy slide, but that's cancer fatigue, right? The cancer itself can impinge on organs that, you know, decrease the energy levels. They can release chemicals into your body. The cancer can release chemicals that make you feel worse. Having pain by itself, or feeling nauseated, constipated. So that also leads to psychological problems. We often have fears around a cancer diagnosis that can detract our energy, that can lead to depression. People who have cancer have sleep problems. They don't get as much exercise as healthy. Nutrition can suffer, and we're going to talk about all these issues. People who come with a cancer diagnosis have other medical problems, right? So if you're suffering from heart disease, or you know, you have low blood levels, low red cell blood levels, these other medical factors can contribute to fatigue. Medications by themselves, for instance, the narcotics or the pain medications, can make you feel drowsy. And then obviously the cancer treatments themselves cause that inflammation and cause your body to have to spend energy to kind of heal the tissue. So that's all leading to a fatigue level. And then this, I think, is really important issue, is that once you're in a fatigue area, then it can kind of spiral in a kind of a negative way. So whether it's, you know, the fear or depression, you're kind of looking at your life and you're feeling like your life is shattered, the stress, the feelings of despair, not sleeping as well, not exercising much, and no, you're not having the same role function, the nutrition's down. And so each of those in turn can make the fatigue worse if we don't reverse the cycle. And that's what the presentation is on today. So the vicious cycles, and how can we get out of it? How can we transcend all of that? So the first point is that there are so many experts in the system that can contribute in some way or form, and they might hit the home run that makes all the difference for your fatigue, right? So obviously you want to talk with your family physician, oncologist, and so on, but there's a psychosocial specialist if you're especially stressed. I mean, I'm seeing, I saw a patient recently, it was very early breast cancer, and she is like in tears because her fatigue is worsening. She's getting radiotherapy. She really needs to see an expert, and there's nothing, you know, weak about going to see a specialist who can work with her stress and her fears, et cetera, kind of reverse that cycle. But there's a sleep specialist. I'm thinking about physio in terms of exercise. I'm thinking about occupational therapy. Everybody should see a dietitian, talk to your pharmacist. So many team members, please tell people what's happening. Maybe they can make the right recommendation, turn around these factors, and help you feel a lot better. Okay, so I think about this. I do, in this situation, I do recommend you kind of do a little bit of Dr. Google to try to figure out what's happening in your life. So for instance, your blood counts could be down. So the hemoglobin, or the red cells that deliver the oxygen, if that's low, then you can be feeling tired. Thyroid function, the thyroid releases a chemical that gives you kind of energy. So if your thyroid is not functioning as well, you get replacement for that. There are other kind of electrolytes and salts in your blood that could have you know, negative effects on your energy. So those can be changed and reversed and so on. Are you suffering from pain? Do you need to have your pain medications adjusted? Do you need radiotherapy to actually get to the source of the pain? These are all ideas you need to discuss with your specialists, physicians. And lastly, there are ways to actually adjust medications if your blood pressure is too low. Or the other one I wanted to talk about was there's a difference between fatigue, which has this kind of multifaceted aspects, and depression, right? So if super low mood for the last 2 weeks, feeling blue, unable to enjoy life at all, you know, unable to do anything, you might actually be depressed. And that has, when you're feeling anxious, is actually another symptom of depression. That has a whole type of treatment itself, psychological and even medical treatment to kind of reverse the chemistry in your brain and get you going again. So again, see the specialist so that you can, you know, feel better, get stronger, get back to yourself, and get back to your wise and compassionate and wonderful self. Now, interestingly, there's no drugs that treat fatigue, nor is there's no blood test, nor is there any type of pill that you can take. I mean, yes, there are certain circumstances where a person is suffering a certain symptom, they might get a steroid pill, and yes, it might help their energy, but that's a very short-term thing. There's no other pill that we take in order to help with fatigue. The self-help, the self-empowerment strategies, however, have been proven to actually help people, and this is what we're going to focus on today. And I'm using the mycancerfatigue.ca outline and the kind of 5 major realms that I've outlined here. So how can you energize your body? And I put and brain because if your body's feeling more energized, then your brain, which is part of your body, will also feel more energized, and you'll feel happier and stronger. And so firstly, I'd say exercise, exercise, exercise. Super important. So even when you're tired, that's the point. So even people who are in the kind of the palliative care phase of their life, they can stretch and get out of bed. There's all sorts of different little activities that can actually change the energy within your body. Many years ago, they did an experiment on medical students and forced them into bed rest, and that by themselves made them feel extremely tired. So you want to get up and get going and kind of force yourself through the kind of fatigue zone in order to get the benefits there. I think about the anti-inflammatory diet. Our brains need energy to actually function. Our muscles, our bodies need that energy. We'll talk about diet. Maintaining a reasonable weight. Usually I think about that as someone who's, has too much weight and needs to come down. This is actually oftentimes people are undernourished and need to actually get a little bit more weight in their body. Sleep and rest we'll talk about. And lastly, practicing a relaxation technique. So important to change how the brain works. In fact, when you practice relaxation, it's much easier to get back into the wise and compassionate part of your brain. So at that talk recently, it suddenly dawned on me, it's inflammation that's adding to the fatigue. Like, why do you get tired when you get the flu? It's like the flu bug is not affecting every single muscle in your body. What's happening is the flu bug is setting up an immune response. Inflammation happens, the chemicals happen. Those chemicals go everywhere. They go up to your brain to say, oh, I'm sick, I need to rest right now. So it's the body's natural response to inflammation and infection to actually settle you down so you have more energy to fight off something. So the inflammation makes us feel tired even though our bodies could function at a higher level. And so an anti-inflammatory diet, exercise is the key. And so I'm thinking about exercise, anti-inflammatory diet, and thinking about your gut, the trillions of 100 trillion bacteria in your gut and the lining of your gut. And if you can decrease the inflammation that's there, you'll have decreased inflammation in your body. Practicing relaxation, working with stress, right? Because when we're stressed and worried and upset and flustered, we send those kind of inflammatory chemicals throughout our bodies, and that decreases our energy and makes us feel more tired, eating away at your body. I show this kind of very busy slide because it shows that in the pharmaceutical, the second one down, there isn't much benefit. Exercise seems to have the most benefit, but if you combine those together, exercise, psychological, etc., you can get a better outcome in terms of your energy level. So what about exercise? I'd say better to do something than nothing. That's for certain. What you're aiming for is to kind of ramp yourself up slowly, slowly, slowly into the space of 150 minutes per week. You start slow. It seems the group-based activities help out. I guess motivational. We're also very much like human, right? And we're really connected with other people. And so I'd say make it fun. Like do it with somebody, make it fun, and connect while you're exercising. I wanted to show you the new guidelines. So you'll see on the kind of left side of the screen is the aerobic activities. That's getting your heart rate up, like slight sweat in the brow, slightly shorter breath, kind of getting that up to 150 minutes per week. And then on the right side of the screen is the new addition to that, which is the resistance training. So can be just like body weights or squats or those things, but you want to use all the major muscle groups, a little bit of free weights, some yoga, et cetera, et cetera. The way I think about that one is you increase the strength and coordination in your muscles, so you're stronger on your feet, but you're also, I almost feel like you're flushing out the kind of chemicals within your brain when you actually use that resistance. We know that people who exercise, they release brain-derived growth factor, which helps us remember and function better. So there's a whole bunch of really important aspects to exercise. I wanted to show you one of my favorite patients here. This is Derek, age 87. He's 10 years out from his prostate cancer diagnosis. One of the few patients who took me up when I told him, Derek, you're going to get on hormone treatment. It's going to whack your energy. You need to exercise. And he started to exercise right from the get-go. He'd get his radiation treatment at 7 a.m. He'd go right to the gym afterwards. And 10 years later, he's still going. It's his whole community. He knows the people there. He wouldn't trade this gym for the world. And he's strong. He's healthy. He's happy. He was even working through his radiation at age 77. So it can be done. And there's my wife on the other side, who's a prostate cancer researcher. Okay, so exercise, exercise, exercise. Number 2, which is pretty obvious, is nutrition and diet. I'd say this is the space where I highly recommend you get in to see a specialist. So you go in to see the dietitian and the nutritionist at the cancer center, in private practice, doesn't matter. Talk with the specialist. Talk to your family doctor, because there's a few things here that can be measured. So they take a blood test for the red cells or the fluids and electrolytes. And they're also, the nutritionist is going to look for deficiencies, both in terms of calories, making sure you're getting enough proteins. You want to have micronutrients from multiple food groups each day, and weight loss. I mean, lots of different issues around cancer and how that can influence our eating. So number 1, talk to a nutritionist. Get the expert advice. I'm showing this slide. Just maybe look down at the bottom. The fatigue reduction diet is in red there. I just thought, oh my goodness, there's the next level of science, right? They're saying, well, it seems like if we can up the protein a bit more, that will help people with fatigue. But you want the fruits and vegetables, the omega-3s. And that, in the earliest study actually improved fatigue. So the data is coming out now in terms of what nutrition, but you would know this, and I'm going to take a quick drink to remind me and you to drink. Make sure you get your fluids every day. I'll tell you a story about the Canada Food Guide. When I first read it, that was probably about 25 years ago, I thought, oh, this is so fluffy and just, there wasn't much substance to it. I just didn't think it was very strong, but they were actually right. And what they're doing is they're relying on science, and they're talking about micronutrients from several food groups every day. And you'll see that the picture is 50% of your plate as veggies, more than a little bit of fruits, right? But then you want the grains, you want the proteins, you have the fluid there. So it's balanced. You want to get your protein intake and the omega-3s, and we'll talk about that in a moment, because the omega-3s help your brain. And secondly, it's like you can do quick swaps. For instance, instead of drinking pop or sugary juice, drink water. The problem is if you take in the sugars, you get a spike, and you might get a little blast right at the start, but your body adapts and takes the blood sugar out of the bloodstream, and then your brain gets deprived of sugar, essentially. And that's where you get irritable and hungry and can overeat at that point, but the brain does not function on low sugar, right? So we want to stay away from the processed white sugars, white breads, those type of things. Stay away from saturated fats, red meats, alcohol, right? So the swaps and the healthy eating, and as well, you're going to take it. Some people like slightly larger meals 3 times a day, or you might go every 2 to 3 hours. you might need a supplement. There's lots of individualization of this, but stay away from the stuff that does not help. I've recently cut out gluten, or tried to, like 98% cutting out gluten in my diet. And my gut does feel better. I just feel lighter and more energized. And so sweet wheat, meat, stay away from. As an opportunity, you can give it a try. So the low glycemic diet, you keep the sugars in a kind of a neutral range, and you do that by eating the more complex carbohydrates and having some proteins with your sugar, because it's the blood, the gut absorbs the sugars more slowly if you have protein along with your complex carbs. I always want to remind people vitamin D, because we live in Canada and we don't get enough of it 10 months a year. And I say vitamin D as well because there's no more science now that shows vitamin D actually helps brain function as well. I just say you should probably get your vitamin D levels measured by your family doctor, because you might need more actually than 2,000 units. And lastly, these healthy fats. I've become an avocado-aholic recently. I think it's the source of the kind of healthy fats. It's no longer a low-fat diet, it's a healthy fat diet. But the flax, walnuts, chia, and some of the leafy veggies also have the kind of parent molecule to the healthy fats. Fish has the kind of second level down, but I also recommend fish like 3 times a week. Fatty fish. Okay, so diet, super important. Get the expertise. Next on the list is sleep. And so I've just been so blessed because I went to a conference recently around sleep, and I just recognized the science of sleep and facilitating good night's sleep in people is really extremely far along. And so we know that when people are fatigued, they don't sleep well, and they don't sleep well, they're fatigued, another one of the cycles. I want to differentiate sleepiness, which is, it's your sleep drive every 5 to 6 to 7 hours. You're getting that, especially if you're staying awake all day. There's a drive within your body to put you to sleep, to actually flush out the chemicals within your brain. As part of why we sleep. That's not what we're talking about today. Fatigue is something that's like transcends that. Even a good night's sleep doesn't necessarily take away significant fatigue. So it's lack of energy, which is different than sleepiness. Okay, so one of the things I realized is that there's a science called Cognitive-Behavioural Therapy for insomnia. So people who aren't sleeping well at night, the quality of the sleep is not good enough at night. There's a whole science of how to get their sleep cycles and the quality of sleep improved. And it's actually pretty harsh what they do, but it is actually, the science shows that it's effective. And I just wanted to tell you about some of those things. So the stimulus control is, if it's the bed is for essentially sex or sleep. And so if you're not sleeping, then you essentially get out of the bed as part of it. So stimulus control, associate your room and that bed with sleep. This is a wild one, sleep restriction. For about 2 weeks, they're forcing these guys to get up at exactly the same time, in the morning. So in fact, most everybody could practice this one. If you get up at exactly the same time each day, if you have a reasonable degree of health, you probably find that you're probably tired over that first week or so, but your body's natural circadian rhythm, which is the sleep-wake cycle, will get adjusted, and you'll simply bring yourself, you'll go to bed earlier, you have a better quality of sleep, better percentage of sleeping time. So that's the sleep restriction part of this. The other one I would say is, for everybody, when you first wake up, try to get the bright light in your eyes for the first half an hour. So that also, at home we have a very bright bathroom light, so that helps me in that situation. But the bright light for the first half an hour helps the circadian rhythm get going. We're talking about cognitive restructuring. I'm going to go through an example of how we reframe our thoughts and how that can be very powerful. But one of them is, just because you get a poor night's sleep doesn't mean your cancer is going to come back. So it's like getting rid of the myths about sleep. And lastly, I'm going to tap on the sleep hygiene, which is the idea that you can promote a good night's sleep. You can't force yourself to have a good night's sleep. So you create the conditions for that. So I'll just go. So the regular sleep cycle, I told you, even on the weekends, you want your bedroom, you're thinking kind of 15 to 19 degrees, dark. So I use eye patches, especially during the summer. Sometimes people like the kind of white noise to go along with that. So that's the second point. Stay away from the stimulants. So that blue light that stimulates our brain, you get those emails, watching the TV. So the bedroom is for none of that stuff, and you definitely need to shut down that good hour and a half beforehand. You can read a book instead. It's quite helpful. I like to retreat. Think about, from an evolutionary perspective, the light was getting dimmer and dimmer before you went to sleep. You want to kind of recreate that in the modern world, right? So you're slowing yourself down, less stimulus, more calm, reading a book with dim lighting. And the last one is you can't go to sleep, you go do something else elsewhere. Now the avoidance part is just as important, right? So you don't like pick a fight or watch horror films just before going to bed. You don't have a big cup of coffee or eat a big meal or exercise. You really want to settle down the psyche, settle down the body prior to getting to bed. In terms of naps, I happen to like naps myself, even 15 minutes. They're saying before 3 p.m. I suggest before 5 p.m. Yes, some people need to take more naps, and you can work that out as to what makes sense for you. And there it is. If you can exercise, diet, get natural light during the day, then you can kind of reset your sleep cycle. Okay, so those are two things where you can potentially influence outcome. Next, I want to talk about the psychological level, because really this is the mind-body connection, right? So if you can feel happier, get into that rhythm of being your best self, get into practicing, because there's neuroplasticity, meaning you practice being happy, positive, grateful, you get better and better, and the neurocircuitry gets stronger and stronger in those realms. We are human though. We're going to have stresses, we're going to have frustrations, we're going to flare suddenly like, this is too much type of feeling. And using your mindfulness, if you can recognize you wound yourself up and it's not helpful to wind yourself up, then what I recommend is the 4-breath technique. And I'm going to take you through this right now. So you can actually do this with me as we talk. One is you're seeing yourself wound up. The earlier you see it, the easier it is to settle down. Press the pause button on the situation, because almost always you do not have to snatch the child from underneath the car. You can make a good decision as to how you want to respond to the situation. So press the pause button. You let go of the kind of catastrophizing thoughts that are causing you the frustration and the stress, like this is never going to get better, or whatever it is. You do that becoming very mindful of your body. So as I talk right now, become mindful of what are the feelings, what are the sensations within the body, without labeling or thinking, bringing your attention, your consciousness down into your lower gut, and then slow breaths, especially slower, longer, smoother out breath, right? So as you're doing that, you're settling down your nervous system and you become more relaxed. You're sending a signal up to your brain, and then you can kind of reassure yourself, well, let's just take this one step at a time. This doesn't help to be too flustered or upset. So that's a technique. Like you're stressed, you want to bring yourself back into your compassionate mind. Secondly, just practicing a relaxation technique. This is not like just having a bath or just going for a walk. It's actually having your attention come back to the here and now, meditation, Tai Chi, Qigong. Reframing stress is helpful. If something is stressful to you, it also means that it's something important to you, and you can use the energy of that to focus your energy. And that's a whole other talk by itself, but you can think of stress as your life force energy, and you can use that energy to empower yourself. Okay, so you reset your stressometer. at a lower level, right? So most of us are like, we're frustrated, we're stressed, and we hold this tension all the time. You can actually lower that down, calmer, so you're coming back home to your better self again. It's the same outward circumstance. The world is going to offer you the same challenges, but you can be in a more calm, clear thinking, positive space by lowering your kind of stressometer. And I just show that as kind of a diagram, right? So most of us are trapped in kind of the upper dotted line where we get kind of stressed and flustered and we kind of hold ourselves there, when the lower line is better where to be. If you get too stressed, you bring yourself back down again. Okay, I wanted to take you through the kind of cognitive behavioral therapy because it is a powerful way to kind of get yourself back to your better self again, because the negative cycle is those thoughts influence how we feel influences how we behave, and then how we behave, feeds back to what we think about the situation, right? And so what we're trying to do is to change the behavior, and when we see the change in behavior, when you take that proactive step, when you decide to get walking and you get out the door and you're slightly short of breath and it doesn't feel quite right and you're not good, but you're sending a meta message to yourself as, I want to get better, I want to get stronger, I want to recover from this, right? And so that makes you feel better. When you feel better, you get more out of your life, you're appreciating your life more, and then you're more willing to take control of your life at that point. So we're working our way towards the right side of the diagram here by reframing and behaving better. So I'll give you an example. So this is based on the kind of classic cognitive behavioral therapy. We put awareness and kindness as a kind of a subtitle based on David Byrne's Feeling Good book from the 70s. And essentially, you can just read the bottom line, which is, when you change your mind as to how you look at the world, you can feel better, the emotions can change, your moods, outlook, attitude, productivity. You can feel better. It's just so obvious. You can practice being the same you that's upset, or you can practice a new you that's that kind of positive self again. So we use a 3-column technique. You'll see up top there's a situation, which is just the raw reality. And then oftentimes we place our thoughts or project our thoughts onto a situation, and this causes the distress, right? If you think to yourself, oh, I'm such a loser, I'm no good, that often leads to a depression, right? If you understood that we all are wonderful, beautiful spirits, then the depression is going to be less. Like, we don't have to follow the negative stuff. So if we can recognize the mindful thoughts in the left column, we can work with those thoughts, and ultimately we can reframe with a sense of kindness, a sense of care and compassion and wisdom at the same time, right? So it's not just putting on a positive mask. So here's an example of a reframe. So you're a year out from your treatment and somebody offers you, let's go to a movie tonight, and you say, oh, do you know what? I know that if I do that, I'm going to be wiped out, so I can't go. So you decided, and you made a good decision in this situation. You said, I can't go, a year later. Now, if you put, the person goes to the movie and you stay at home and you start thinking about this and you start talking to yourself in a negative way, this is what might happen. This fatigue is ruining my life. I can't do anything. I'll never get better. This is totally unfair, right? So if you talk to yourself that way, it's going to lead to, feeling down and depressed. And so if you can hear yourself talking that way, the exaggerated way, what emotions would follow that way of thinking, right? Well, I feel down, despair. How would my body feel? I'd actually have less energy. So if I'm feeling down and despaired, then I'm actually sucking the life force energy out of myself. Is it helpful or harmful? Are you actually empowering yourself? Are you feeling better by talking to yourself this way? No, so it's harmful. How is it exaggerated or irrational? So then you start to question, like a lawyer would question it. This fatigue is ruining my life. Well, definitely it's influencing, and my life may not be as good as it was, but is it totally ruining my life? I can't do anything. Is that true? You're doing nothing at all? That's not true. It will never get better. Well, that's a prediction. That's the fortune teller error. That's also a cognitive distortion. This is totally unfair. So that's a kind of a judgment that we placed on the whole situation. It's 100% unfair. There's no good in the situation. So we can see this is not helpful. So then how would a wise and compassionate person talk to you, like your wise grandmother? Because this is how you have to talk to yourself. You could say something like, oh, this is really hard, but let's work with this. So I'll just give you my reframe. So firstly, listen to the quality of my voice. It's like, this is really frustrating. Yeah, this is a tough situation. But you know, it doesn't really help to exaggerate. That just makes me feel worse. And there are many other things that I really enjoy in my life. And I can work with this. I can get stronger. There are lots of different ways to rebound from this. And I can find meaning and express my spirit and love in this world, even if I'm fatigued. Right? So that's an idea of a reframe. It doesn't take away from the fact that you made a good decision, decide not to go out because you're too weak that particular night. But you can look at what you can influence and encourage yourself and be wise and kind. The self-compassionate route to change is the most effective. That's also scientifically proven. So the last couple parts of the presentation, one is sometimes the reality will be that you will have a very low energy level, and that's going to be part of your life. It's part of the reality. So how do we work with this? And if you're going to fight against reality with the kind of those cognitive reframes, like it shouldn't be this way, life should not be this way, which is a concept. If you can work with that concept, reframe it to find what you can influence, then you'll feel better. I'd also say then I get very, very practical in the circumstance. And that is, there's a whole kind of science of energy management, or you have like an energy bank. And first of all, say, this wowed me when I started to do the research there. You can talk with an occupational therapist. There are a whole bunch of techniques that you can use to actually maintain your energy, get more functionality, enjoy your life more by understanding this. And if you're not going through it, somebody else in your life might be going through this and you can help. Or maybe 30 years from now, when you're an older person getting through those last year of your life, this will also be very powerful. And I won't go into this in depth, but essentially quite pragmatic. What needs to get done, right? And how do I want to do this? So you're actually planning it out like a wedding, for instance, and you prioritize the activities that are most important to you. And really what's super important is you cut out the extra unnecessary stuff. So for instance, does watching television news really make you feel better? No. Does maybe certain social medias make you feel more tired? And so you really need to cut out the unnecessary stuff. Come back home to the kind of heart level, what's most important to you. You want to pace throughout the day, right? So we don't sprint. One of the dangers is that I've seen, if people feel great one day and then they try to do a lot, they sprint for about 10 hours and then they're whacked totally in the next 2-3 days type thing. So pacing is important. And lastly, there's this whole kind of technique around keeping your posture right, positioning, using extra things. For instance, you could cook sitting, so you can kind of maintain your energy or preserve your energy. You can sit while you take a bath or a shower. There's lots of different kind of modifications that can really, you have this energy. What do you want to do with your one wild and precious life? Asked Mary Oliver, right? So you have this. What do you want to do with it? It's really the question I have for you. Talk to the people you love. So on the next topic, it's important to talk. Let them know what your priorities are. Let them help you. In fact, they'll feel better if you let them help you. And because you're probably listening to this webcast, you're more likely to be the independent sort that doesn't want to ask for help for people. Well, God's economy works such that there has to be givers and receivers, and it's the cycle of life. So please ask for help. And then you just recognize we can slow down and connect with people and find out what's most important to us. Okay, so to finish off, I want to talk about this kind of sense of spirituality. And again, I'm not prophetizing, I'm just offering my perspective. Interestingly, so spirituality comes in many, many forms, as you can read there. So it's not necessarily part of a faith-based community. It can actually be quite personal. I think of it as kind of a transcendent, being able to see your life from a bigger perspective. And there's evidence, right? I think it has spirit, mind, body connection. When you can draw on the principles, the highest principles of love, connection, gratitude, joy, bring that into your psyche, allow that to infiltrate your body, and that actually improves fatigue levels, mood, quality of life. Mindfulness-based stress reduction. Again, I recommend this. Mindfulness, really about staying in the present, because all of your life happens in the presence. In the present. Bring your presence to the present. All of your life happens then, right? Your ability to connect with other people, to be able to experience love, to be able to give love, to be able to grow, transform, transcend, all happens in the present. And that's why it takes mindfulness in some sense. Okay, so the transcendent perspective for me is to remember what's most important to you, because we can easily get drawn off into, you know, lots of things that could be wrong, but what's most important to me, the prayer that I say first thing in the morning is to let my love out, to be of help to other people, to be kind and caring. And it doesn't matter, in my perspective, what role you play in life or what your health is like right now. We all have that opportunity to bring our best self into this world. Let your light and love out. And so I like that as a practice. It can be this a secular prayer, or I like it going into circumstances. I like it when, you know, I'm suddenly flustered and I try to remember to come back home to what's most important. And there's this idea of an observer consciousness. In the one hand, you know, you can be experiencing frustration and fluster and fatigue and all the kind of true grit and difficulty of life, but there's an observer consciousness that can watch your life. And that observer consciousness has been with you your entire life. And this, remarkably, is very peaceful and joyful and energized, right? And so we can experience both of those at the same time. So you can tap into that observer consciousness that starts to point you towards the bigger spiritual picture. So be a light, be the model, right? The next person who walks into that room, you can love them as much as you can. A unselfish plug for our book. You can pick it up through our website, The Healing Circle. It's the complete teachings of a weekend retreat along with the stories of people who have attended the weekend. So you can order that through our website. And it does talk about body, mind, and spirit. So that's one resource. I also want to just point you to many other resources here. So if you want to Google Reclaiming Your Energy, coping with cancer-related fatigue, it's a series of videos produced by Princess Margaret Hospital in Toronto. Fantastic outlining. I really like this 10-minute kind of animated video by Dr. Mike Evans, so you can Google that. I pointed you to untire.me, which is, you can actually get an app, and there's whole kind of technology. My Cancer Fatigue actually has an entire workbook. So Astellas, the pharma, produced this with the experts that I was pointing to, but there's an action plan, so it takes you through the various elements of what you could do, the steps and your choices, and so on. They have a whole management guide, so the whole presentation is in paperback with notes, et cetera, et cetera. And lastly, which is the science of this, is there is an action plan that captures like your energy levels and what you did and so on. So there's kind of techniques and proven ways to actually monitor your fatigue and make a difference. So mycancerfatigue.ca is an excellent resource to empower yourself, and I really think you can make a difference. And so there's the website for My Cancer Fatigue, lovely website. And back to you, Kelly. I'm very happy to take questions and serve everybody as best we can.
Yeah, thank you, Rob. That was a great presentation. We are running a bit short on time, but I think we can probably do 2 or 3 questions, maybe 4, before we have to go. And just a reminder to anyone who has to leave at 2 o'clock Eastern that this will be recorded and available tomorrow on our YouTube and SlideShare accounts. So we do have a few questions right now, but anyone who wants to ask a question can certainly type at any time, and they'll be passed on to Rob following the webinar if they're not asked now. So Rob, why don't we start out with one about nutrition? You mentioned consulting a nutritionist to identify deficiencies and to do an assessment of diet. Can you provide some guidelines around how to go about searching and selecting a nutritionist? Are there any that are publicly funded, or is it only through the private system?
Well, within Canada, you can go to the cancer center. They have nutritionists in every single cancer center that have access to it. And that's free, essentially. And those, I really do trust them. They are the experts that have worked with the science and have a lot of experience.
Great. We have a couple more general questions too. This one's interesting. This person says that their family and friends are not really interested in discussing their cancer-related fatigue issues, and they even say that their oncologist might be too busy to discuss the fatigue. Do you have any recommendations for them?
Yeah, so this is so common. It's a kind of post-treatment phenomenon. The person gets through their treatment, and then 2-3 months later, they physically look fine from the outside, and people are kind of assume that they're feeling fine, and yet the fact is there's a residual, both emotional, and there can be obviously the fatigue component that's left over afterwards. And so the friends and family may not be supportive, but it doesn't stop us from saying this is the reality for me and this is what I need to kind of get better. And I agree that oncologists, we're just kind of bringing this to light that fatigue is such a significant issue. So one has to continue to advocate for oneself, in that office, saying, I have this particular problem. Is there any specialist who can help me? And again, the cancer centers often have those extra people. It's a physiotherapist, dietitian, occupational therapist, sleep specialist. They often have, not every single one of those, but people that you can tap into. Psychosocial specialist, social worker. There's a lot of expertise. You need to advocate for yourself. Be the squeaky wheel, because that's the only way it really gets done in many, many circumstances. But bless you, I know that's a really difficult circumstance and very, very common as well.
Thanks, Rob. We have another difficult question here. Hopefully there aren't too many people watching this who are in the same boat, but just in case. This person says, the information shared in this webinar has been very helpful. I would be interested to know if Dr. Rutledge has any complimentary advice to give those of us who have been given a terminal diagnosis.
Yeah. So that's the reality as well. And that's why, sometimes if somebody is very weak because they're in the terminal phase, a lot of the advice here is not going to actually change the fatigue level because the cancer is having a problem, causing the problem. I'd say at the same time, though, there still is opportunity to kind of do a transformation at level of spirit. And I work with a chaplain, spiritual care specialist here, who really describes the incredible things that happen kind of at psychological and spiritual level. So there's always the opportunity to love that next person and to express what's most meaningful to you, even in the most difficult situation. So bless you. I know that's a really, really hard circumstance, and there's mourning to that as well, right? This is not like it's easy or you're just going to feel happy all the time. It's we mourn, and that part of our heart also allows us to love more as well.
Thanks, Rob. Maybe we'll take one last question here. This one's pretty trendy at the moment. Question on nutrition. I've been hearing and reading a lot about the keto diet, whole foods, reducing carbs, increasing fats. Any knowledge on the science of this?
Yeah, so I'm pretty sure that the keto diet doesn't kind of change cancer. I don't believe that, but the science will be evolving. I do worry that the keto diet doesn't promote the vegetables and the healthy other micronutrients that you get with a more balanced diet. So, but at the same time, that's just my opinion, and what I recommend to anybody is continue to do your research, use your rational mind, be kind of like a scientist, use your logic, and at the same time, trust your gut as to what feels right for you. And after you eat that way, how do you feel, and so on. So you want to use both wings of the bird, both the science and the intuition and your inner guidance.
Great. I think we'll wrap up the questions there, but I will send any remaining questions to Rob to answer on his own time if he has time. And if anyone has any further questions, you can direct them to myself at communications@survivornet.ca, and I'll pass them along as well. So that brings us to the end of today's webinar. I'd like to thank you again, Rob, for your great presentation.
Thank you.
Just a reminder to everyone that this webinar has been recorded and will be available in full tomorrow on the CCSN YouTube and SlideShare accounts, and that also all registrants will receive an email with a link to the recordings as well. Please feel free to share them with family, friends, colleagues, whoever you think that could use them. CCSN hosts weekly webinars. If you'd like to sign up for any of the others, you can visit our website at survivornet.ca. And I think that's everything. Thank you everyone for attending and have a great afternoon. Thanks again, Rob.
Take care. Take care, everybody.